Hello dear doctors, welcome to the class of Kidscovery. Myself Dr. Parv and we are discussing about pediatrics. In pediatrics, the topic of discussion for now is pediatric immunology, and in pediatric immunology, the topic of discussion is none other than Chediak-Higashi Syndrome. Chediak-Higashi Syndrome, we think that a very fancy name. The disease is also very fancy, and the most fancy person sitting is in front of you on the other side of your screen. That is me. My name is Parv from P. You can remember the fancy thing, that is the Chediak-Higashi Syndrome. So P, a lot of P's are there in Chediak-Higashi. There is partial albinism which is going to be there. There is photophobia which is going to be there. There is peripheral neuropathy which is going to be there. Okay. So these three P's are something which are very important. Then you can have the episodes of normal bleeding. So you can just remember, I'm just telling you, I'm giving you a caution. I'm just telling you to remember this way that you have got some platelet problems. Although the cause of bleeding we are not sure, but you can just remember platelet problems so that you can easily remember bleeding. Okay, and then you have got some P for what? P for you have got some infections. So you can remember from P, pus. So from P, pus, you can remember pus is because of infections. So frequent infections involving the mucous membrane, the skin is going to be there. Okay. So can you see here, this child is having a partial albinism. The child is having photophobia. Okay. Specs and everything he has got. Now you can see the infections which is going to be there on the skin and on the mucous membrane, that's going to be there in the Chediak-Higashi Syndrome. So coming on to the details, I have told you Chediak-Higashi Syndrome is actually a pediatric syndrome which is because of the immune system deficiency. So it's an autosomal recessive immunodeficiency syndrome. My rule is very simple. Whatever is autosomal recessive, I don't give a mnemonic for that. So if you want to make a guess in your exam, you can always go for autosomal recessive diseases. Okay, because other things I always incorporate in the mnemonic so that you can remember. Okay, so coming on to so what is going to be there? There is going to be a hypopigmentation which is going to be there. And now why I call Chediak-Higashi as an immunodeficiency disorder? Because the neutrophils are not going to function properly. So please remember again one more P, that means polymorphonuclear cells. Polymorphonuclear cells are also not going to function properly. That means there is a dysfunction of polymorphonuclear cells which is going to be there. So what happens? There is a LYST protein, LYST gene problem. I have told you Chediak-Higashi is a fancy thing, and I am the fanciest person sitting in front of you on the other side of your screen. So what is important? P, L for LYST gene problem. L for what problem? L for LYST gene problem. So because the LYST gene is issuistic, there is defective storage and synthesis of secretory granules. So secretory granules are not going to get secreted, not going to get stored properly, and the main killing thing is there in those storage granules only. If they are not going to have the proper release and synthesis, the neutrophils will show dysfunction. Okay. So this is something which is seen in actually the lysosomes of leukocytes. Okay. And the melanosomes of melanocytes. So the problem is this only now. See, the storage granule is something which is not being able to secrete. And this storage granule in one form, in melanocytes, it has got melanin. So if the melanin is not being secreted from the melanocytes, of course the child is going to have albinism. And if there is no secretion of the killing substances from the neutrophils, lysosomes, they are going to be what? They are going to have the immunodeficiency things also. That's why please understand, there is a hypopigmentation of the skin. There's going to be blonde hair. Okay, albinism. And then one thing more is blue eyes. Okay, blue eyes are also going to be there. Now one important thing, very important thing, please understand that hypopigmentation of the skin can occur in albinism also. But if you remember, I have already told you P for what? P for partial albinism. Why partial albinism? Because the albinism is going to occur in patches, because the hypopigmentation, not albinism, hypopigmentation is going to come in the patches. So what is the early issues? What are the early problems? So early problems is adenopathy, glands problems, gingivitis, malaria is heat rash, jaundice and recurrent sinopulmonary skin infections, pulmonary neuropathy, gait abnormalities, seizures, intellectual disability. Now, just you have to understand that, in the later stages, we have seen that there are a lot of viral infections which occur, especially the Epstein-Barr virus, and that's why it causes a lymphoma-like infiltration. Okay, so lymphohistiocytic lymphoma-like infiltration, which is going to occur because of Epstein-Barr virus, and because neutrophils are less, of course, there is going to have staph, strep infection, gram-negative and fungal species infections also. So we have to do a bone marrow transplant. That's going to be the therapy of choice, the treatment of choice in order to cure the Chediak-Higashi syndrome. So please, bone marrow transplant is something that you have to perform. Okay. Thank you so much for watching, and I will see you in the next class. Thank you.